Sua Excelência Paulo Kagame, então ia convidar para ir todos a tradução, canal 3, number 3.
Channel 1 is English, Channel 3 is Portuguese. Channel 1 is English, Channel 3 is Portuguese. Your Excellency Paul Kagame, President of the Republic of Rwanda, the first ladies here present, distinguished members of the governments here present, distinguished guests, ladies and gentlemen. Of all the human rights, we can claim the most basic and primary is the right to a decent life, a dignified life. My first remarks are of gratitude to His Excellency President Kagame, President of the Republic of Rwanda, for honoring me with the invitation
para tomar parte na 20ª Cimeira Internacional
20th of the session of the International Conference on AIDS and Sexually Transmitted Infections in Africa. I'm also grateful for the warm welcome and for the opportunity to address Your Excellencies and share the challenges of Mozambique with regards to AIDS and infectious diseases in Mozambique. In hosting this event, Rwanda conveys a clear and strong message on the need to gather efforts to eradicate this scourge in the health sector that can undermine the dreams and projects of a prosperous Africa. Every 2 years, ICASA provides us with an opportunity to come together and reflect on the progress, challenges, and constraints that our government grapple with in the framework of the combat of these scourges. On the other hand, these meetings also serve as a platform to mobilize more African leadership and the entire international community to reaffirm our commitment through concrete actions against HIV and AIDS. Mozambique is one of the most affected countries by HIV and AIDS in sub-Saharan Africa. Therefore, in addition to drawing experiences, we have come to Kigali to reaffirm the determination of our government to combat HIV and AIDS pandemic and the proliferation of infectious diseases until the eradication out of more than 37 million people living with HIV by 2018. 68% are in Africa. It is curious that sub-Saharan Africa also represented the region where more progress was recorded in terms of the number of patients under antiretroviral treatment and reduction of new HIV infections over the past years. For Mozambique, these indicators are a result of efforts by the government and the society at large in combating new infections and in antiretroviral therapy and in the prevention of mother-to-child transmission, among other measures. Despite being insignificant, these figures are the result of many sacrifices and decisions for austerity that our economies require at this particularly difficult moment that the country is faced with. Mr. President Kagame, President of the Republic of Rwanda, Excellencies, dear participants, we welcome the challenging theme of this conference, AIDS, Free Africa, innovation, community and political leadership, because it draws our attention on the need for quick and sustainable control of this pandemic within the framework of the global agenda and sustainable development goals. To meet this global challenge, Mozambique has introduced in 1999 the National HIV and AIDS Strategic Response Plan, and in 2000 the National Council on AIDS Prevention and Combating was established, and this council comprises private sector and civil society representatives and individuals of recognized merit as a national response coordinating body. The establishment of this body stemmed from the understanding that a medical response should be accompanied by a multi-sector approach, integrating cultural, economic, political, and social factors. Mozambique has adopted the strategy of UNAIDS joint program and the guidelines of the World Health Organization and mainstreamed, domesticated them in its HIV and AIDS national response strategy and in its national norms and policies. As an example, we have domesticated the concept of priority population made up of vulnerable population and key populations in recognition of the existence of groups in a more serious risk of infection and disproportionately more affected. In the area of prevention, the plan embraced the approach of HIV combined prevention. Equally, we have adopted UNAIDS 1990 strategy as a way of accelerating antiretroviral treatment by more Mozambicans living with HIV and AIDS and stop HIV transmission, and we have assumed the guideline test and initiate of the World Health Organization, which aims to provide immediate access to treatment for any HIV-positive person. As a result of these efforts, about 1,300,000 Mozambicans are under antiretroviral treatment. With these measures, in 2018, we recorded less than 24% of AIDS-related deaths, as compared to the beginning of 2015, when we started our governing cycle. The mother-to-child transmission prevention program is available in all health facilities. All pregnant women attended in antenatal consultation know their HIV status and are now benefiting from this treatment as soon as it becomes necessary. In 2018, we also launched the national campaign Free to Shine through the Office of the Spouse of the President of the Republic, a continental initiative of the first ladies, the first spouses, with the support of the African Union and partners. The objective of this campaign is to galvanize efforts and support individual and provide collective understanding of action to leverage the provision and effective use of health services and other resources to end child AIDS by 2020. We associate to this initiative the elimination of congenital syphilis and hepatitis B in an approach called triple elimination, intended to eliminating HIV and congenital syphilis and hepatitis B in Mozambican children. Unfortunately, despite all efforts and progress I mentioned earlier on, close to 1 million Mozambicans do not have access to antiretroviral treatment, and we continue to lose our fellow citizens due to HIV-related deaths. Retention in healthcare has been a major challenge, as only 70% of patients remain in care and treatment after 12 months of treatment, according to the latest data. Structural barriers are still prevalent, including stigma and discrimination and cultural practices that increase vulnerability among key and vulnerable populations, and it limits the access to prevention, testing, care, and treatment services. Excellencies, distinguished participants, if we want to end HIV epidemic, we must, as the Director General of the World Health Organization, we must invest in innovation. To innovate, we need relevant and quality information, and part of this information will come from documentation of best practices that we have achieved so far, as well as from scientific research. We need leadership capable of conveying the right message and mobilize our brothers and sisters first to prevent HIV and AIDS and then to follow antiretroviral treatment. We should recognize the great merit of the community approach and its potential to develop solutions. Communities have an added responsibility in retaining patients in care and treatment through their contribution in the improvement of the quality of services and support to patients at household level and in communities themselves, and interventions in the fight against stigma and discrimination. Above all, we need to strengthen political leadership at all levels, a leadership that leads processes, mobilizes resources required for the implementation of strategies to fight HIV and AIDS, and African leadership committed to the cause. Ladies and gentlemen, research and innovation should equally play a key role to increase the coverage, quality, and effectiveness of African health system and beyond. Health research conducted on the continent should be in a collaborative way, but with an increasingly stronger input from African scientists and institutions. Technological and processes innovation at the level of the health system is an area that should also deserve special attention by the African governments. For example, in Mozambique, we can cite the use of point-of-care technology, and that the implementation of these technological innovations impact positively on the clinical management of patients living with HIV. Evidence is produced by Mozambican institutions have guided the process of implementation of these technologies in our national health service system, and they were used as the basis for updating technical directives of the World Health Organizations on this subject. To conclude, once again, I wish to congratulate my brother, President Kagame, who has become a champion in this subject, and I would like to congratulate and I wish him to continue this way. President Kagame and all organizers of this forum, which brings back hope and the right of to a dignified life to men and women. I wish all participants frank, fruitful, innovative, and open discussions. Thank you very much for your attention.